Okay, happy Wednesday, everybody. Let's get started. Thanks for taking some time out of your day to listen to some successful collaboration examples with healthcare systems here at U.S. Health Center. This is Healthy Beat. This is something that we do every Wednesday, so feel free to join whenever your Wednesdays permit. Our agenda today, we're going to spend about 10 minutes doing a U.S. Health Center overview. I'm Gavin Quinnis. I'm your moderator today. After I'm done, I'm going to share some experiences at 4 panelist presentations that we're going to share with 4 of our health systems. Feel free to type your questions into the interface, and we'll address as many questions as we have time to get to at the end. We expect about 15 minutes of content. And with that, we're going to get started. Our mission at U.S. Health Center is to improve people's health and reduce healthcare costs by providing industry-leading health management science, technology, and advocacy to prevent and manage disease. 4 things that our clients tell us that make us different is our Predictamed next generation analytics and predictive modeling, our international screening and lab service sophistication, where we can help you reach out and touch people throughout the continent, our one-stop shop on both technology and service platform that includes everything for all the various stakeholders in your population, as well as our holistic coaching, where we bring the advocacy behind the science and technology to help facilitate ways in which we encourage engagement. We have a 6-step model that we've been fortunate to deploy throughout U.S., Canada, Mexico with hundreds of different clients in a variety of different industries and settings, and we're going to talk about, obviously, focus on health systems today. Our solution is targeted at getting ahead of the onset of disease prior to the appearance of symptoms. We try to operate on the right-hand side of this and engage programs that focus on the 4 Ps, where we predict, prevent, personalize, and engage and increase the participation of our members throughout our population. The first step in our 6-step process is to identify the risk. We've been fortunate enough to have this process independently third-party validated by the Intel GE Care Innovations Validation Institute, where they took a look at over 15,000 cases over the last 5 years and compared our ability to predict the onset of disease as it relates to the diagnosis. So which individuals did we predict were going to have a given condition, and did those predictions result in a diagnosis? And then they came out with a statement that said we're 80 to 93% accurate depending upon the disease in predicting the onset of disease prior to symptoms. So how do we do that? Well, we're believers in synthesis analysis. We take a look and understand that every disease is different. Different studies have different findings with different factors and different weightings. By taking a look at what the world thinks causes various conditions through studies that are performed by various institutions, we then can understand what data we need to collect, how to weight that data, and how to collect the data. And we do this through a combination of data collection that is persistent in all the different silos, the family history, the genetics, the biometrics and laboratory data, lifestyle, demographic data, pharmacy, and medical claims. Run it through our engine, and that creates a roadmap for where we need to go, where we've been, where we are now, where we're going in managing and preventing disease. So we focus on over 75 different conditions and lifestyles. It's important then to look at the conditions because that helps us understand how to predict the future costs. We know that the average spend of members receiving care is approximately $8,000 a year. And so we would expect a predictive model to come out with a risk burden of about $8,000 a year for those persons that are going to be seeking care in the immediate future. And this is an example of a report that our system generates that tells us exactly where the conditions are erupting, how many of them, and how much cost might we expect. And then we take a look at the risk burden per participant to understand what the trending is. And here's an example of that magic number of $8,000 here for these 595 individuals and these $5 million worth of claims. This gives us fact-based decision as to where we want to focus our intervention and where we want to focus our ability to engage and participate the member participation. The next step in our process is to manage the predictable. Now we know where we've been, where we are, and where we're going. Now we can focus our energy appropriately and employ our process here. And so by understanding where given individuals are, whether they're in the lifestyle, pre-disease, chronic disease, or large case, or any status along the way, or combinations, so those individuals that might have an existing condition that have a new one erupting, or what have you, how might we deploy tools like holistic coaching, education, incentives, and disease management, those type of processes. So our team works with your teams on the consulting, the advising, the communication, the incentives, whether that's participant or provider, and everything associated with that process. So with our solution comes experts that know how to deploy the solutions. This should result in better health outcomes, and we're fortunate enough to have done a number of studies and look at the examples. So we can slice the data and look at repeat participants, new participants, your overall population, or in this case, participants that are engaging in the process that we know is the most effective. As an example, holistic coaching combined with incentives. Where was the population at a prior time? Where are they now? What areas are the population electing to work on? Where are the coaches having the successes? And how much savings might that result in? Of course, all of this requires a continuous and constant data analysis process, and we have a full complement of a cloud-based SaaS model in our population health management ecosystem that faces all the various stakeholders within the population. So as an example, our personal health dashboard starting here at 11 o'clock is information that where you have the engagement that's personalized in the portal, in an app that has all the personal health record information, the protocols, the videos, the lifestyle management, the incentive management, and the content custom to that individual in managing and preventing the diseases, the conditions, or the lifestyles that they are having to wrestle with or prevent. We aggregate the data and create fact-based decision opportunities to focus areas on cost, on readiness to change, on program interest, on return on investment, on where you're trending, what your strategies might be. And the third aspect of this tool set that we're talking about today is a coach tracker. That allows the coach or the administrator to track, stratify, manage the disease, the pre-disease, the lifestyle, or whatever we're focusing on with that model in what we would call a holistic approach. Our Health Counts module is an incentive design process solution that is put in the hands of the administrator where we can track, do reporting, manage events, activities, manage reasonable alternative standards, integrate with payroll, health savings, eligibility management. That's critical to understanding where we are and how we're performing and managing rewards. Our content management system is something that allows you to personalize the information on the personal health dashboard, educate, steer the members, modify the protocol. So if you have capacity in a given area where you want to bring in members and steer them to providers that are seeking new patients, there's a way to do that and personalize the information. Put your videos on there, customize surveys and protocols. And then our sweeper tool helps us analyze the medical and pharmacy claims, how to various populations, different TPAs, different programs compare to each other, where are gaps in care, and what kind of utilization might we expect. So this should result in lowering costs, and we're happy to say that we're darn near batting 1,000 on this. When we take a look at an example like this 3-year mitigation study we did last year, where were these 2,400 participants across 24 different clients. Fortunate to see that over 2,000 different medical conditions were slowed or prevented or attenuated. There's that magic number, about $8,000 per case that was reduced of risk burden, about $16 million of total risk burden reduced. Another example of collaboration that we are starting to work on with healthcare systems is what we call the Precise Health Plan. And this is a solution where we take all the stuff that we've spoken about earlier in the population health management, and we build that into an administrative model where we can manage everything from the consumer involvement and transparency, the administration. We built a whole host of various medical plans, MEC plans, MVP plans, executive, small group, all different kinds of plans. Of course, the technology, the reporting, there's a PBM component built into it, along with the population health, the networks, reference-based pricing, and the stop-loss insurance. So all of the neat little package so that you, as a health system or a broker, an employer, can take full advantage of how the population health management works seamlessly within the insurance aspect of the program.